Okay, good afternoon, and thank you for joining the daily briefing on the City of Philadelphia's response to COVID-19. Today, all of our speakers are joining us the briefing virtually to adhere to social distancing guidelines. We will now begin our briefing with opening remarks from Mayor Jim Kenney. Mayor, you now have the floor.
Thank you very much, and good afternoon, everyone. This week is National Travel and Tourism Week. Tourism has been a major industry for Greater Philadelphia for a long time and a huge source of jobs. In 2018 alone, the region welcomed a record 45 million visitors, and those people generated $12.2 billion in economic impact. In 2019, Philadelphia County had over 76,700 hospitality-related jobs, making it the city's largest and fastest-growing employment sectors. Sadly, the industry is suffering, and thousands of its employees are out of work right now. Travel isn't happening, and major tourism sites are closed because of the impact of COVID-19. But I am confident that our tourism industry is strong and resilient. That's because we have great organizations like Visit Philadelphia and the Philadelphia Convention and Visitors Bureau, the Pennsylvania Convention Center, and the Greater Philadelphia Hotel Association. In fact, today, the Convention and Visitors Bureau released its annual report. The report looks back at 2019, and obviously, we are now in a vastly different world. CVB decided to release the report anyway to raise awareness of the role and importance of travel in our local and national economy. I know they and all of our tourism and hospitality partners are working hard to make sure that when we can welcome visitors back, Philadelphia will be ready. Another particularly timely commemoration is that today is National Nurses Day. So it is an appropriate time for all of us to say thanks to the thousands of nurses in the city, region, and nation who are working in the midst of this pandemic. We know that healthcare workers are among those most at risk for contracting the virus, yet they continue to go to work to care for those who are affected with COVID who are struggling with other diseases. They do so knowing that they are risking their own health and the health of their loved ones. I know that our Health Commissioner, Dr. Farley, joined all of us in thanking all the nurses of Philadelphia healthcare facilities. They are true heroes. And when we finally get through this pandemic and the nurses can finally slow down and get some rest, they can take comfort knowing they personally are responsible for saving lives and restoring livelihoods. The docs get a lot of attention, but none of this would be possible without our nurses. Nurses run the hospital. This week is also Correctional Employees Week, and I want to recognize all the essential workers in our prisons. As I've said before, city employees continue to be on the front line of this pandemic, and those working in the prisons are no exception. Today, I visited the Curran Fromhold Correctional Facility on State Road to thank the correction officers and employees for their dedication during this challenging time. During my visit, I toured the Philcor print and upholstery shops responsible for making COVID-19 related items. This includes the production of face masks and COVID-19 flyers and other print materials for our giveaway meal boxes. Philcor trains inmates within the Philadelphia Department of Prisons by providing real-life work experiences to equip them with transferable job skills and a work ethic that will help prepare them for post-release reentry and employment. I want to thank everyone who made today's visit possible. And again, I want to thank our correctional employees for the dedication to their jobs during this time. And as we all know, Mother's Day is this Sunday. And with the potential for good weather, I want to remind everyone of the importance of celebrating safely and responsibly. We must continue to follow the guidance of public health officials, including the need to stay at home. We should not gather physically, even in small groups, except with immediate household members. This is especially critical for those of us with mothers who are older, have underlying health conditions, who are living in long-term care facilities. While these restrictions are tough for many of us and our loved ones, they are necessary to prevent further spread of COVID-19. Despite these limitations, there are plenty of safe, creative ways to celebrate. You can spend time together virtually on a video conference like Zoom or FaceTime. For those who are less tech savvy like myself, a simple phone call can make all the difference. A homemade card or handwritten letter gives you the chance to put a personal touch on your Mother's Day message. And you can support local businesses by ordering a special meal for pickup or delivery. Ultimately, this year more than ever, it's the thought that counts. We owe it to our moms and the mother figures in our lives to put their health and safety first. So wear a mask and save a mom. Wear a mask. Now we'll turn it over to Dr. Farley for his daily update.
Thank you, Mayor. Situation with the epidemic today is similar to where we were yesterday, where we have plenty of cases of the infection, but we are clearly on the downslope of the epidemic. Since this time yesterday, we have 287 new cases confirmed, bringing us to a total of 16,697 since the beginning of the epidemic. Now, there is a delay in reporting from some of the big laboratories, and so that number is probably a little bit artificially low. We would expect a higher number tomorrow when we get more of those reports in. Still, overall, the trend in daily counts is downward, and that's a good thing. We are making progress on the clusters we're seeing in settings that are congregate shelters, congregate settings like nursing homes and other facilities like that. The cluster of people in the city's jail has a new low of 26 inmates who are positive, but 0 new positives since yesterday, and 3 inmates who have recovered have been removed from isolation. I do have to report, unfortunately, we have 60 new deaths confirmed since yesterday. Now, our information doesn't come in an equal amount every day. A couple of days ago, we reported 0. We're picking up some of the backlog of those cases of deaths now, bringing us to a total of 803. Overall, still, if you look at our trend on deaths per day, the trend is downward in parallel with the epidemic, and that's a good thing. Of the 803 total deaths, 424 or 53% were nursing home residents. So the epidemic does continue to hit nursing home residents hard. Our hospitals are seeing a little bit of a reduction in the cases that are hospitalized. We have 936 people with the coronavirus infection in Philadelphia hospitals and 1,739 hospitals in the region. Those numbers are a little bit lower than they were this time yesterday. And I hope that that's a good sign. We continue to make efforts to expand the availability of testing across the city. As you know, we've added more test sites this week. Some of those sites have lots of people who are coming to them. Others don't have quite as many. All the sites, though, are asking that you call ahead to make an appointment. If you call ahead to make an appointment, you get a sense for how busy they're likely to be. If you go to our website, there's information about phone numbers for all the different sites that you should use to call. Just to remind people, our recommendations for testing are for anybody with symptoms compatible with the coronavirus infection, with a priority for people who have symptoms and are either in a high-risk group or in a high-risk situation. And that includes people who have chronic medical conditions, includes residents and staff at congregate facilities, includes public safety workers like police and fire officers and emergency medical workers. It includes other essential workers, people working in grocery stores and pharmacies, and includes contacts to known cases. All of those are for people with symptoms. We're not at the moment recommending testing for people who don't have symptoms. Now, I'm getting an awful lot of questions about reopening Philadelphia. Everybody wants to know when we're going to be able to do that. Everyone wants to know, even I want to know when we're going to do that. But I can't say because I can't predict the future. We're still learning about this virus. We're still learning about this epidemic. The virus has more surprises in store for us. So we're just going to have to see how it goes. I understand that uncertainty is difficult for everybody. That is simply the situation we're in, though. I can say, though, that right now we are clearly moving in the right direction. Our actions are very much slowing the spread of this virus. Our actions are very much saving lives. So right now we need to simply keep doing what we're doing that's working, which means stay home. When you're out of a home, wear a mask. Again, information on the epidemic overall is at phila.gov/COVID or 1-800-722-7112. Thanks.
Thank you, Dr. Farley. We are now going to turn it over to Armando, who will give the Spanish translation of both the mayor's remarks and Dr. Farley's remarks. Thank you.
Mensaje del alcalde Jim Kenney para el miércoles 6 de mayo del 2020. Buenas tardes a todos. Esta es la Semana Nacional de Viajes y Turismo. El turismo ha sido por mucho tiempo una industria importante para el área metropolitana de la Gran Filadelfia y una gran fuente de empleos. Solo en el año 2018, la región recibió un récord de 45 millones de visitantes que generaron 12.200 millones en ingresos. En el año 2019, el condado de Filadelfia tenía más de 76.700 empleos relacionados con la industria de la hospitalidad, con lo que se convirtió en uno de los sectores de empleo más grandes y de más rápido crecimiento de la ciudad. Sin embargo, a raíz de la pandemia, está sufriendo y miles de empleados están sin trabajo en este momento, porque las personas no están viajando y los principales sitios de turismo están cerrados debido al impacto del COVID-19. Pero estoy seguro que nuestra industria del turismo es fuerte y resiliente. Y esto se debe a que tenemos grandes organizaciones como Visit Philadelphia y la Oficina de Convenciones y Visitantes de Filadelfia, el Centro de Convenciones de Pensilvania y la Asociación de Hoteles del Gran Área de Filadelfia. De hecho, hoy la Oficina de Convenciones y Visitantes publicó su informe anual. El informe es el del año 2019 y, obviamente, ahora estamos bajo circunstancias muy diferentes. La Oficina de Convenciones y Visitantes decidió publicar el informe de todos modos para crear conciencia sobre el rol del turismo en nuestra economía local y nacional. Sé que todos nuestros socios en materia de turismo y hospitalidad están trabajando arduamente para asegurar que cuando podamos volver a recibir visitantes, Filadelfia esté lista. Y hoy también es el Día Nacional de las Enfermeras. Por lo tanto, es un momento propicio para que todos agradezcamos a los miles de enfermeros y enfermeras de la ciudad, de la región y de la nación que trabajan en medio de esta pandemia. Sabemos que los trabajadores sanitarios se encuentran entre los que corren el mayor riesgo de contraer el virus. Sin embargo, ellos continúan trabajando para cuidar a aquellos que están infectados con el COVID-19 o que están luchando con otros males. Lo hacen sabiendo que arriesgan su propia salud y la salud de sus seres queridos. Sé que nuestro comisionado de salud, el Dr. Farley, se nos une el día de hoy para agradecer a todas las enfermeras en los centros de salud de Filadelfia. Son verdaderos héroes. Y cuando finalmente superemos esta pandemia y las enfermeras finalmente puedan volver a su ritmo normal y descansar un poco, podrán consolarse sabiendo que son responsables de haber salvado muchas vidas. Los médicos siempre reciben mucha atención, pero nada de lo que hacen sería posible sin nuestras enfermeras. Gracias por el trabajo que realizan diariamente. Y esta semana también es la Semana de los Trabajadores Correccionales. Y quiero reconocerlos a todos los que son trabajadores esenciales en nuestras cárceles. Como he dicho antes, los empleados de la ciudad continúan en la primera línea de lucha contra esta pandemia y los que trabajan en las cárceles no son una excepción. Hoy visité el Centro Correccional Curran Hold en State Road para agradecerles a los empleados por su dedicación en este momento de tanto reto. Durante mi visita, visité las tiendas de impresión y tapicería de Philacor, que son responsables de fabricar artículos relacionados con el COVID-19. Esto incluye la producción de máscaras faciales, volantes informativos sobre el COVID-19 y otros materiales impresos para nuestras cajas de comida. Philacor capacita a los reclusos dentro del Departamento de Prisiones de Filadelfia, brindándoles experiencia de trabajo real, para equiparlos con habilidades laborales transferibles y una ética laboral que les ayudará a prepararse para el reingreso y el empleo después de su liberación. Quiero agradecer a todos los que hicieron posible la visita de hoy y nuevamente quiero agradecer a nuestros empleados correccionales por su dedicación en estos momentos. Como todos sabemos, el Día de la Madre es este domingo y con un buen clima potencial, quiero recordarles a todos la importancia de celebrarlo de una manera segura y responsable. Debemos continuar siguiendo la guía de los funcionarios de salud pública, incluyendo la orden de permanecer en casa. No debemos reunirnos físicamente, incluso en grupos pequeños, excepto con los miembros inmediatos del hogar. Esto es especialmente crítico para aquellos de nosotros con madres que son mayores, que tienen condiciones de salud preexistentes o que viven en hogares de ancianos. Si bien estas restricciones son difíciles para muchos de nosotros y para nuestros seres queridos, son necesarias para evitar una mayor propagación del COVID-19. Y a pesar de estas limitaciones, hay muchas formas seguras y creativas para celebrar el día. Pueden pasar tiempo juntos virtualmente en una videoconferencia con Zoom o FaceTime, y para aquellos que tienen menos conocimientos de la tecnología, una simple llamada telefónica puede marcar la diferencia. Una tarjeta casera o una carta escrita a mano le da la oportunidad de darle un toque personal al mensaje del Día de la Madre. Y puede apoyarse en las empresas locales al solicitar una comida especial para recoger o para entregar. En última instancia, este año más que nunca, lo que cuenta es pensar en ellas, porque todo se lo debemos a nuestras madres y a las figuras maternas en nuestras vidas, por poner su salud y su seguridad ante todo. A todas nuestras madres, gracias. Y esta es la actualización en materia de salud al miércoles 6 de mayo del año 2020. Los números van mejorando. Desde ayer se han confirmado 287 nuevos casos del coronavirus en Filadelfia. Actualmente tenemos un total de 16.697 casos en la ciudad. La tendencia es que los casos han ido disminuyendo. Ha habido un retraso en el reporte de varios laboratorios, pero podemos esperar un aumento de los números para el día de mañana. Hoy no reportamos casos positivos del COVID-19 entre los internos y actualmente de 26 casos registrados, 3 internos adicionales se han recuperado satisfactoriamente. Tristemente, hoy también reportamos 60 muertes por la COVID-19 en la ciudad. Un total de 803 personas han muerto por la COVID-19. 424 o el 53% de estas muertes han sido en hogares de ancianos. Les recordamos que este virus no discrimina por raza o por género. 936 personas han sido hospitalizadas en Filadelfia y 1.739 personas han sido hospitalizadas en la región sureste de Pensilvania. Las pruebas están disponibles con previa cita. Para mayor información como direcciones o números de teléfono de los centros de prueba, por favor visitar el sitio web fila.gov/COVID-19, pestaña FAQ. Se ha expandido el criterio para administrar las pruebas. Se les ofrecen a personas de todas las edades que presenten síntomas ahora. La prioridad la tendrán los siguientes grupos que presenten síntomas del COVID-19. Personas con enfermedades crónicas o preexistentes, residentes o personal de entornos grupales, tales como asilos de ancianos y refugios, oficiales de seguridad pública y trabajadores esenciales de supermercados, farmacias y otros. También las personas que hayan tenido contacto con un caso confirmado del COVID-19. Las pruebas no se recomiendan para personas que no tengan síntomas. Queremos reabrir Filadelfia lo antes posible. La forma de hacerlo es tomando todas las medidas para prevenir la propagación del virus. Usa la máscara cuando estés fuera de tu casa. Esto es algo absolutamente necesario. Mi máscara te protege a ti. Tu máscara me protege a mí. Juntos podemos superar este gran reto. Gracias.
Thank you so much, Armando. We are now going to move to our Q&A portion for members of the media. We do have limited time during these briefings, so only one representative from each media outlet is permitted to ask questions in the first round. Reporters are asked to limit their questions to 3 or fewer, and we will do a second round of questions if time permits. So for those logged in today, please use the raise your hand feature. It can be found under the participants list. We also ask that you use video to ask your questions if you are able for broadcasting purposes. And now we will begin unmuting reporters one by one to ask your questions. First, we will go to Max Marin of Billy Penn. Max?
Hi, good afternoon, everyone. Thank you. Just one question today. There is a rally planned for City Hall on Friday, demanding that the city reopen its economy, similar to other demonstrations that have happened across the state and country. Is the city aware of this, and is there a response or a plan for how it'll be handled?
We're aware of it. I don't know how big it's going to be. It's mimicking some of the other things we've seen around the country that's inspired by the president. We will treat it like we treat all demonstrations, with respect to the First Amendment, and making sure that everyone remains safe. And that's it.
Are you going to be enforcing social distancing at all, or?
My understanding is that this is what we hear, is that the protest is going to take place inside vehicles.
Okay, thank you, Mayor. That's all.
Thank you, Max. We are now going to go to Shawn Walsh of the Inquirer.
Thank you. Just to follow up on that, Mayor, what's your message to those folks who are planning that protest?
Make sure you wear a mask, and we'll open when Dr. Farley and other medical experts tell us it's time to open. And as we can see in other places, you're starting to see spikes in Florida. I expect spikes in Georgia. And we do not want to take the position, which seems to be emerging from the White House, and through people like former Governor Christie, which was appalling, his comments yesterday. We are not going to sacrifice people's lives. There's no such thing as collateral lives. They're all human beings. They're all part of our country, state, and city, and we're not going to sacrifice anybody intentionally.
They're specifically calling, I think, for you to set a timeline or some kind of benchmark.
You can't set a timeline. I mean, the timeline is what the virus dictates, and that's been the case since the beginning. I mean, we certainly have target things we'd like to see happen, but unless unless the data is not, as Dr. Farley has very effectively taught us over this period of time, unless the data indicates that it's safe, then it's not safe.
I just meant to ask, as far as the governor's benchmarks for when counties can reopen, can you unilaterally reopen Philadelphia in your view, or do you have to?
First of all, I wouldn't do that. Second of all, I don't know the answer, the legal answer to that question. But we're in constant contact with them with the governor's office on a regional basis, so that we're all walking in the same direction.
Thanks. And lastly, you mentioned the tourism industry in Philadelphia. Is there any update on whether Welcome America is going to happen this year?
We should have something, I think, the 12th. There's
an announcement.
There's issues surrounding that we want to flesh out before we make the full announcement.
A full announcement, presumably, that we're leaning towards not holding it?
We'll know on the 12th.
Okay, thank you.
Thanks, Shawn. We're going to go to Natasha Brown of CBS 3 now.
Hi there. This message is for Dr. Farley, or the question, actually, a couple questions. First is, locally, we understand that there may be 2 children at St. Christopher's Hospital, just in reference to the Kawasaki disease that's now apparently being linked to COVID-19 and how children are being affected by COVID-19 at this point in light of this disease. Dr. Farley, can you tell us any more about that, and also how many cases we are seeing of that here in the area?
So I have not heard about specific cases in hospitals here in Philadelphia. Kawasaki syndrome is a disease that's been around for a long time. It's a disease that's not fully understood what causes it. And I think it's too early to say whether it's actually linked to COVID infection. I think we're going to have to learn more about that. I think, people may want to have answers to these questions, but I don't think we have answers yet. Certainly we know that the vast majority of children who get this infection do fine. And so if it is related to it at all, it would be a pretty rare complication.
Okay. And again, you've been talking just about, the virus is going to set the timeline here. So as much as people want the city to be reopened, obviously there can be no deadline in a sense, or no official time there. And you also mentioned that the virus still has more surprises in store for us. Tell me a little bit more about what you mean by that.
If you look at the national data, there have been articles in the past couple of days that have pointed out that if you separate out New York and New Jersey, that there are parts of the country where cases are rising. And what's happened there is a virus has sort of found a new population. It was declining in one population, but then it got into a new set. And so we can't guarantee that it has found all the populations that it's going to find, even in Philadelphia yet. The virus has only been around for a few months. The things about this we don't understand. And so that's why we need to watch this every day. People want me to make predictions, but we can't, because it continues to come up with things that we didn't expect.
All right. Thank you very much.
Okay. Thank you, Natasha. I'm going to give it about 15 more seconds to see if we have any additional questions, but at this time we do not have any other hands raised. So we'll just give it a few moments, but this is the last call for questions. Okay, Shawn Walsh of the Inquirer.
Thanks. Is there any more clarity on the number of especially full-time employees of the city who might be affected by the layoffs that are coming down the road?
Not at this point.
Okay, thank you.
Thanks, Shawn. We're going to go to Martin Pratt of Philly YBN.
Thank you. Dr. Farley, can you explain some of in the latest couple of days, there have been numerous news reports that says that coronavirus has mutated, and you just expressed that the population outside of New York, New Jersey, the population that are being affected by corona are new population. Is that a mutation considered, or is that just the same old virus affecting new people? And can you also speak to this so-called mutation theory?
No, I haven't read any scientific paper on the mutation. I would be very skeptical that the virus has fundamentally changed. What we're seeing around the country is what often happens in epidemics is the virus just finds a new population. The virus is, if you think about it from its point of view, it's succeeding. It's taking over the entire globe. So why would it need to change? Evolution doesn't work that way for an organism that's succeeding. So the basic issue is just the virus is out there continuing to have an epidemic wave that's rolling across the country and periodically finding new pockets where it can be successful.
Thank you.
Thanks, Martin. We're going to go to Laura McChrystal with the Inquirer now.
Hi. We've heard that some advocates for the city's homeless population have, I guess, some issues with how the city is dealing with those folks, and there was potentially a protest planned. I guess this question would be for Brian. We heard they were potentially planning to protest outside your home today. Any comment on that?
So yes, so I'll confirm that they did protest outside my home. And I think their concerns, which I share, are that we're not moving fast or not doing enough, not moving fast enough. I share those concerns. I think we are doing everything we can for our unsheltered population. It is what folks have to deal with on a daily basis without the pandemic is heartbreaking and tragic, and what they're having to deal with under the current conditions is heartbreaking and tragic. I do think it's important for us to put this in context, because I do think there are some just incomplete pictures and incomplete facts that are out on the table. They want us to, we are reviewing our protocols surrounding our quarantine and isolation space on a regular basis. We've already provided returning citizens the opportunity to enter into those spaces, and certainly want to get our most vulnerable folks who are currently in congregate settings into our quarantine and isolation spaces. And if we have to amend our protocols again, we will do that. We have contracted behavioral health providers and continuing to look at prioritizing rental assistance to prevent homelessness to begin with, and actively working through a lot of complex problems with all of our shelter providers and those that work on these issues. Eva Gladstein, Liz Hirsch, and their staffs are meeting on a regular basis with providers and advocates, and if we need to kind of rethink what that format looks like, we're certainly willing to do that. But they've helped us solve some really key issues like food distribution, adding additional bathrooms and hand washing stations, and really continuing our outreach to unsheltered populations. So I understand that there are some folks who are unhappy with us and feel like we should be doing more. But I think we're certainly committed to this work. And remain committed to it. I do think, again, want to provide context. Philadelphia had the fewest number per capita of unsheltered people before the crisis, and we still have the fewest per capita of unsheltered people during the crisis. We've served over 5,700 people in our shelters. And that is all to the benefit of our outreach workers and those shelter staff that really put their heart and soul into this work that I frankly couldn't do, and really proud of what we're able to do under really difficult circumstances.
Okay, and Brian, I think you were asked yesterday by a different reporter if how the number of shelter beds currently available compares to, if it's more or less than typically is available this time of year. Could you clarify? I think you had said you would have to go look for the answer. Do you have that?
No, I said I thought it was the same, and I confirmed it is the same. So we have not lost shelter beds because of our efforts. So we have done two things. We have tried to de-densify our shelters, which we've successfully done, but we've also added beds. And so what those winter beds that normally would have come offline in March, we kept online. And so the number of beds that we would have had available this spring are the same number of beds that we would have had available last spring. So that has not changed.
Okay, and one last question on the homeless population. The folks at the airport, we've heard from some advocates that, who are, I guess, saying that they're not, necessarily coming from the city to the airport, that maybe they're getting dropped off somehow from the suburbs as encampments are cleared there. What do you know about where those folks are coming from?
We certainly are aware of some folks traveling by bus from 69th Street to the airport, and that's largely because SEPTA is free, and I think people know that they can go somewhere. And we've heard anecdotally that, we've had folks dropped off from other counties. I think that is challenging for us to confirm, but we are working with the folks who are actually at the airport and trying to understand where they came from and what the impact is, and certainly working in partnership with the airport. As I said yesterday, what's happening there is inappropriate, and we're going to have to make some changes. But we also need to make sure that we do that in a humane and just fashion, so that people have somewhere to go.
Okay, thank you.
Yep.
Thanks, Laura. And our final question will go to Martin Pratt of Philly YBN.
Yes, these questions are for Brian. Brian, have we found out any more information about free internet access for the students that do not have internet access in their house?
Did the school district get back to you on that question?
No.
Okay, so we'll circle back. We'll circle back and make sure that happens.
Okay, and the second question is, and it's my final question, is do the budget cuts affect the Citizen Planning Institute and or also the Food Policy Advisory Board?
I don't believe it impacts the Food Policy Advisory Board. On CPI, I am not certain because it's outside of my portfolio, but we'll confirm and get back to you.
Thank you.
Thank you, Martin. That concludes our briefing for today, and we will see everyone back here at 1 p.m. tomorrow. Thank you.